This is post-care instructions for patients of mine that have had a filling put in. I'm going to generalize with both silver or white fillings because generally the instructions are the same. The only major difference is silver fillings. You should not eat. On them for about 2 hours, as silver fillings do harden up, similar to concrete over time. Versus white fillings are hardened up in the chair. If you've had a white filling, you notice the blue light that's shined on it. That actually hardens the filling, and when you get up out of the chair, it's going to be as hard as it's ever going to be. So it's hardened or cured immediately, when silver fillings take a little bit longer because they set up on their own. Probably the biggest instruction immediately after the filling is not to drink something very hot. I'm always nervous for patients because they want to go drink. They've been in the chair, they get a hot cup of coffee, they're numb, they don't know how hot it is, they can burn themselves, or they can chew their lip if they're trying to eat. I've seen that happen all too many times where they come back panicking because their lip is burnt or something and it looks awful. If anybody's seen a traumatized lip, it swells like crazy, or a tongue, it swells like crazy, it bleeds, it looks awful, and it takes a long time to heal. So immediate care is getting some, just being careful with the area. As the numbness wears off, I typically will give my patients Advil or Tylenol or both because you're usually a little bit sore around where the needle was, and sometimes we have to push on the gums for the filling. We have to put stuff in and around the gums, so oftentimes the gums around there are kind of sore. Those are the most common. So usually Advil is on board, or if it's not, you can take an Advil for a little bit of soreness. So next, most important instruction would be if the bite feels off. We always try to make the bite even before you leave the dental chair, but inevitably you're leaning back, you're numb. We can't always get your bite perfect. It's very important that you don't think that the filling will wear on its own. It will not. It'll cause problems, it'll cause toothaches, it'll cause your tooth to be very sensitive, it'll cause your tooth to break. It's very important, if the bite feels off, get back to me or your dentist or whoever and have them adjust the bite and make sure it's even. It needs to be done as quickly as reasonably possible. It's not an emergency. You can go back the next day, but you don't want to sit on it and just think, oh, it'll wear into place. I've heard that before, and it's not the truth. You do want to get it addressed. When it comes to sensitivity, 2 to 3 days of sensitivity for both silver or white fillings is not uncommon. We try to desensitize the tooth. We try to do everything we can, and I'd say 80% of the time, 90% of the time, we have no sensitivity. With white fillings, even higher percentage of the time is no sensitivity. I do find that silver fillings tend to be a little bit more sensitive for a few days, but ultimately the sensitivity will go away for both of them. If the cavity was deep, most of the time I'm telling my patients, listen, this cavity was very deep, it was very close to the nerve, and so sometimes this pain can become worse. We need to know that. If you start having dull, throbbing pain, aching pain, pain at night, sharp shooting pain, these are all things that we need to know about. For the most part, like I said, 95% of the time, you should have little to no sensitivity. 2 or 3 days is normal. If the bite needs to be adjusted, let us know. But those are the major take-home messages. Ultimately, if after 3 or 4 days you're still feeling something off, get back to us, call us, something, get in. Thank you.